Nigeria is heading towards another crucial election, and as always, health security remains an important issue for the country. The recent COVID-19 pandemic and infectious disease outbreaks in different parts of the country have once again highlighted the importance of epidemic preparedness and response for any nation. Join us as we hear from Nigerians on the importance of funding for epidemic preparedness and response, and their hopes for a healthier and more secure nation.
As with everything in Nigeria, they will try their best, and probably their best is not good enough sometimes.
Yeah, I think I will rate them probably somewhere around 70 to 80% because of different reasons. One is, despite the challenges of resources, the government was able to make sure that the spread is not that highly impacting.
Some projection made by some other global community and other global institutions whereby the catastrophe will be so high in Nigeria when it's come in. So we are highly disappointed. That is attributed because Nigerian government and Nigerian expert professional in medical industry, they manage it very perfectly.
Yes, I will rate them 8 to 9% because they really tried during the pandemic and they ensure that all the country, the communities are intact and safe.
I'm not very sure if they have put enough structures in place because for the last pandemic, Nigerians still found a way of going around some of the measures that were put in place. Like people would not go and take the vaccines except when they are compelled because they needed to go for the vaccines when they want to travel abroad.
Actually, I won't say they didn't do much, but there is a lot that needs to be done because normally epidemic doesn't announce when it comes. So when it comes, mostly you need to be prepared. So I think the government needs to do much preparation.
There is no structure. I hope government will try to put more facilities.
Yes, actually they really put their effort in providing some safety centers and medical centers, including quarantine, research places, hospitals.
There are structures, but they are not enough. And they are not enough, especially if you go to the local government levels, community level, I mean. That is where we have the weak structures because the structures are not really strengthened, are not fully really established and strengthened.
Government hasn't been doing enough in terms of putting structures and mechanisms to anticipate and to prepare and respond to emergency situations in the country.
We have seen how the government have suffered in trying to protect the proliferation of COVID-19 because we lack proper adequate quarantine centers, we lack proper equipment and sensitive materials to make sure that all these diseases were not proliferated and disseminated to the general public. So I believe the structures are poor.
Funding is key because it's only through funding that you can be able to get the resources, that you can engage the media, that you can get religious leaders, that you can pay for the allowances. Yes, it is very important, but the accountability of the funding is also one of the most important things. You can have funding, you can have billions of naira to support that, but if there is no accountability, it is not. And also prioritization also is very important. Even if you have funding, if you don't prioritize key things that will give you a result.
Is when there is money, that's when everything will be set in place. So I think founding of money and raising of funds will help in tackling all these issues of pandemic when it comes to corona and all sorts of diseases.
Funding is everything. I hope government will provide more money to the health sector.
Funding is very, very vital because now, for instance, during the COVID-19, there was a lockdown and people can't go out for their daily activities, their work to get what they eat. So now, government needs to cushion the effect of the lockdown and other things. Now they need to give some palliatives. So yeah, they give the palliatives, but more needs to be given.
And so forth. So funding is very critical. You need funds to develop a quick response structure. You need funds to develop an emergency logistic plan.
funding is critical to any development, especially in 21st century. Anything needs funding. So if proper funding will be put in place with regard to carving out or protecting this outbreak, I believe we'll see a lot of development in R&D in the area of healthcare management, in the area of health professionals protection, health security.
Funding is very important. As I said, you need to move people from the poor masses from their homes to the hospital or to the isolation center. So now money is, the funding is very vital to do that.
Okay, what I think the government will prioritize on is by sharing awareness, doing orientations for the community.
Educating the people, because sensitization, prevention is better than cure. So you need to ensure that so much funding is going into mobilizing communities, using the key and trusted structures at the local community level. For example, religious leaders, traditional leaders, civil society organizations, women groups, media, and all of that structures.
I think first is awareness, creating proper awareness, and second is research and development. Without proper awareness, we will not be able to protect all these disease outbreaks. My decision will be influenced by the kind of manifestos all these candidates have in the upcoming election.
It has an effect. I need to measure and see the policies. What are they trying to implement? Is it different or better than what the sitting government did? If it's better, the person with the better policy is who I'm going to vote.
To me, I will look into your manifestos and see if the health comes second. You can't even go to school if you are not healthy. You can't eat if you are not healthy. You can't travel if you are not healthy. But the priority is security. After security, to me, then we'll go to the issue related to health.
Yes, I think it is a very important, factor that can influence, people to vote whoever they want. But unfortunately, these manifestos are not even available to the general public for them to know. And the general public are not also aware about how important the agenda for health, for the candidate.
As we head towards the 2023 elections, Nigerians are calling on their leaders to prioritize health security. Adequate funding for epidemic preparedness and response, as well as the overall health infrastructure, is crucial for the nation's well-being. We hope that those vying for public office listen to the voices of their constituents and make health security a top priority.